Mpox, formerly known as monkeypox, is an illness caused by the monkeypox virus. Previously, this virus has been associated with infections transmitted from wild animals in Africa. However, in recent years, there has been a surge in unusual cases of Mpox that have prompted global concern. The World Health Organization has issued its highest alert level due to the rapid spread of this viral disease, particularly across Africa. Mpox is a contagious viral infection that can spread from person to person and sometimes through contaminated surfaces or objects. In regions where the virus is present in certain wild animals, it can also be transmitted to humans through direct contact with these infected animals. In 2022, the WHO recommended renaming the disease Mpox to reduce stigma and association with monkeys, as the disease can also infect rodents and humans. For decades, Mpox was predominantly found in Africa. However, for the second time since 2022, it has been declared a global health emergency as the virus spreads rapidly across Africa and has entered other continents. Anyone can get Mpox. In Africa, the majority of cases have been seen in children under 15 years old. Outside of Africa, the virus has primarily affected men who have sex with men, although it has also infected individuals outside of this group. Mpox mainly causes flu-like symptoms such as fever and chills, and a rash that can take weeks to clear. We have gathered 5 things that you need to know about this deadly disease. Number 1. It's caused by a smallpox-like virus. Mpox is caused by a virus which belongs to the same family as the smallpox virus. Smallpox, which has been eradicated globally, and Mpox are both part of the orthopox virus genus within the Poxviridae family. The monkeypox virus was first identified in 1958 when outbreaks of a pox-like disease occurred in monkeys being held for research purposes. The first known human case was reported in 1970, involving a 9-month-old boy in the Democratic Republic of Congo. Mpox was already gaining the world's attention, and recently, the World Health Organization has declared this virus as a pandemic following the detection of cases in remote areas of Pakistan. Number 2. It causes pustules and other symptoms. Symptoms of Mpox typically appear between 5 and 13 days after exposure, though it can take up to 21 days for them to appear. If you start experiencing flu-like symptoms like fever, a rash usually follows within 1 to 4 days, starting on the face, hands, and feet before spreading to other parts of the body. This rash may initially resemble pimples or blisters and can be painful or itchy. The rash can extend to the inside of the mouth, the genitals, and even the cornea of the eyes. As the rash progresses, it forms scabs that eventually fall off, and in severe cases, large sections of skin may detach. Though the symptoms generally ease within a month, Mpox can be fatal in about 1 in 10 cases, with children being particularly vulnerable to severe outcomes. Early symptoms of Mpox include fever, headache, muscle aches, backache, swollen lymph nodes, chills, and fatigue. Number 3. PCR test is required for diagnosis. Since rashes are a common symptom in various diseases like chickenpox and measles, the World Health Organization advises using diagnostic testing to confirm Mpox when needed. The recommended method for accurate diagnosis is PCR, or polymerase chain reaction testing. This is because orthopox viruses, including the Mpox virus, produce antigens and trigger antibodies that may resemble those produced by other related viruses. As a result, antibody or antigen tests alone cannot definitively identify the Mpox virus, making PCR testing essential for a precise diagnosis. Number 4. It can spread through various ways. The monkeypox virus originally spread to humans from infected wild animals, such as rodents and primates, found in the rainforests of Central and West Africa. However, human-to-human transmission is now occurring. Similar to viruses like Ebola, Mpox spreads from person to person through close contact with someone who is infected with the monkeypox virus. This close contact can involve face-to-face interactions, such as talking or breathing near one another, which can generate droplets or short-range aerosols. Skin-to-skin contact, such as touching or sexual activity, mouth-to-mouth contact, or mouth-to-skin contact. During the global outbreak that began in 2022, the virus primarily spread through sexual contact. A person with Mpox can transmit the virus to others from the time symptoms have started until the rash has completely healed and a new layer of skin has formed, and all lesions, including those in the eyes and other parts of the body, have resolved, which usually takes from 2 to 4 weeks. The Mpox virus can also persist on clothing, bedding, towels, objects, electronics, and surfaces that have been touched by someone with Mpox. Another person who comes into contact with these contaminated items may become infected, especially if they have cuts or abrasions, or if they touch their eyes, nose, mouth, or other mucous membranes without washing their hands first. Cleaning and disinfecting surfaces and objects, as well as proper hygiene after touching potentially contaminated items, can help prevent this type of transmission. Recent data suggests that some individuals can spread Mpox to others 1 to 4 days before their symptoms appear. Number 5. Currently, there's no cure, but we have an old vaccine. Currently, as of 2024, there is no specific treatment recommended for Mpox by WHO. However, healthcare professionals may use antiviral drugs like tecovirimat, also known as TPOXX, which are used to treat smallpox, to manage Mpox cases. The United States Food and Drug Administration, or FDA, has also approved the Jynneos vaccine, also known as Imvamune or Imvanex, a smallpox vaccine for use in severe Mpox cases in individuals aged 18 and older. For most people with Mpox, treatment focuses on relieving symptoms. This can include managing skin damage from the rash, ensuring adequate hydration to help keep stools soft, and pain management. The smallpox vaccine was instrumental in eradicating smallpox decades ago, and it is highly effective, about 85%, in preventing Mpox. However, the original first-generation smallpox vaccines are no longer available to the general public. A newer vaccinia-based vaccine, approved in 2019 for the prevention of both smallpox and Mpox, is not yet widely available. It's important to note that even if you have been vaccinated, you can still catch Mpox. For individuals who may not respond well to the vaccine, healthcare providers might offer vaccinia immune globulin, which contains antibodies from people who have received the smallpox vaccine. This can provide some level of protection or treatment for those at higher risk. To conclude, we can say, while most cases of Mpox are mild, some can be severe, particularly in immunocompromised individuals, young children, and pregnant women. The illness typically lasts 2 to 4 weeks. If you have a new rash or any symptoms of Mpox, contact your healthcare professional. If you are infected with Mpox, you can help to prevent spreading it. Isolate from other people and follow your doctor's instructions until your sores are fully healed. So, what is the Mpox situation like in your country? Subscribe and stay with us for a continuous stream of expert advice to elevate your daily living and embark on a path to a healthier you.